Well, good morning, good afternoon. On behalf of the American Heart Association, I'd like to welcome you to today's webinar, Expanding Care in Dental Clinics, Process and Impact Panel Discussion. My name is Aaron Leash, and I'm a Business Development Manager at the American Heart Association. Today's content is proudly supported by Delta Dental. All right, next slide, please. First off, we'll start off with some housekeeping. We'll go over a few items to fully participate in today's event. All attendees are muted. Only our panelists will be on camera today. We do have closed captioning available. Can be engaged by clicking on the CC icon at the bottom of your screen. This session is being recorded and will be shared afterward. If you have any questions, feel free to use the Q&A panel for questions at any time. If you experience issues, try leaving and rejoining the webinar or checking your internet connection. Please stay until the end for our live Q&A. We have, after we have our overview of the sites, we have some great panel discussion Q&A going on. Resources icon located at the bottom of your screen looks like 3 pieces of paper. You can choose documents and click on the arrow to download the resource available. And if you'd like to connect with us, feel free to connect with Brooke at her email address on the bottom right of the slide. Next, please. The American Heart Association, through the American Heart Association's Healthy Smiles, Healthy Hearts initiative, we are proud to recognize the following oral health sites for integrating blood pressure screening, patient education, and referral into everyday care. This honor reflects the dedication of our change champions, those leading the way to expand access, improve risk detection, and help patients live longer, healthier lives. Thank you for driving this impact. Next slide, please. The recommendations and opinions presented by our guest speakers may not represent the official position of the American Heart Association and American Stroke Association. The materials are for educational purposes only and do not constitute an endorsement or instruction by AHA, ASA. The AHA, ASA does not endorse any product or device. Now, it is my pleasure to provide a brief introduction of our panelists for today's webinar, and they will then provide you with a high-level overview of their site. We have Dr. Thomas Allen, who is the Dental Director of Old Farm Dental in Mill Creek, Utah. We have Dr. Armin Nazarian, the owner and dentist at Beverly Hills Dentist. And we have Dr. Hamid Afshari, who is the Chief of Dental Service at Southern Arizona VA. Next slide, please. Here's our faculty disclosure information elements, showing that nobody has any conflicts. And we'll start off with Dr. Allen. Dr. Allen, let's begin with you. The floor is yours, sir.
There we go. Sorry, yes, I'm the dental director, Old Farm Dental in Mill Creek, Utah, just right outside of Salt Lake City, and also assistant professor at the Roseman University College of Dental Medicine. What I'm put this program in, I was part of the Learning Collaborative and the writing group that started this program, and I've implemented the program into my practice. It's been, I would say, almost a year or so that I've been doing it, and it's been with a lot of success. A little pushback here, a little there, a little bump in the road, but in the end, all in all, it's been a positive for us. And the patients are happy, and a lot of them are impressed, that we are going beyond what they're used to having us do. Yeah, thank you. Yeah, private practice, solo practice. One, yeah, I have a couple dental assistants, one hygienist, a full staff. We're a pretty active practice, 5-day-a-week practice, and so we see a lot of new patients. So the program is getting a lot of interaction. It's really helping. And one thing too with the what's going on right now with the those patient education packages that we're giving out, they've been a hit. And next slide. Is there a next there? Okay.
We're on to Dr. Nazarian. Thank you, Dr. Allen.
Thank you.
Yes. Dr. Nazarian, are you on mute?
Yes. And I'm sorry, I just don't have a camera to connect to for some reason. So get the camera. Yeah, it's not undoing it.
It's okay if you don't have a camera that's available.
Okay. Okay, so
Thank you.
yes, I'm the owner and dentist at Beverly Hills Dentist, my practice. I've been here since 1998, and I'm a private practice. I have a private practice, and my practice is, as I said, is located in Beverly Hills, California, and we started doing the implementation in September of 2025, and it's been very successful, and our patients are very welcoming to that idea, and we haven't had any, maybe I can count on one hand the pushbacks, but the staff has been very helpful, and the patients have been very, as I said, they like very much what we're doing, and we have at the same time, I think what they call saving lives, and it's been very helpful to them, because some of them did not know that they had high blood pressure, and they found out by continuing to come to us, and finally realizing that they should see their PCP. So, yeah, that's all I have to say for now.
This is your slide as well, Dr. Nazarian, as well for your system overview.
I'm sorry?
This slide is yours as well for the system overview, if you'd like to speak to that.
Yes, so the blood pressure screening in our in my opinion, it's very helpful, because we are showing our patients that there is dentistry and medicine are connected, and we're not just treating teeth, we're treating the whole patient. And this is something that opens up the conversation. So a lot of patients would come in and they wouldn't realize that what we're doing is very much connected. But now as we're doing this more and more in our office, they're making the connection, and also understanding how, for example, gum disease is connected to their overall health, not just their oral health. And in the beginning, with some of the processes that we had to go through, we did encounter some challenges as far as the staff is concerned, some pushback, because at first it was unknown to them. They didn't know how to do it, how they didn't feel as confident. But slowly they felt more confident by learning more, by having meetings, and it didn't take long for doing that. And then it's very important to have the right equipment and the right making sure that we have the American Heart Association's recommendations in mind when we're ordering the blood pressure cuffs, and making sure we have everything, the large sizes of the for our different sizes of patients. So this change, the kind of impact it had in our workflow, at first it wasn't as fast. because it was new, but it only took like a couple of weeks before we could integrate it with the doing the consent forms and making sure that the as they're signing their consent form, they go into the room and they take a seat, and they the measurement is taken. Sometimes we need to, if we need to check it again, like wait few minutes and then we recheck. Even that doesn't take long, and it's become such a part of our routine that it's just like taking X-rays. Like you would say, well, X-rays take a long time. We don't want to take X-rays. How is that even possible? You have to take X-rays. So this is just another important process that we have to go through. And also, I would say the referrals to the medical doctors, that is a little difficult for us because we still maybe I shouldn't say difficult, but I should say just because our patients have mostly PPO insurance, they know how to go and look into finding a PCP that is close by and convenient for them, just like they find their dentist. So we make sure they understand the importance of that, and we give them cards that we have from American Heart Association that we state the blood pressure measurements for the last several visits and different times of the month, different times of the day, and different times of like different every 3 months or every 6 months when they come in. And we write that down, give it to them, and they take it with their with them with everything else to their doctor, and it helps a lot. We've had patients who've done this, and now they're on blood pressure medication, which they would have not found out that this was something that they had to do. And also the kits have been very useful to us as well. Patients find it helpful to have their little the bags and the water bottle and the medication box to remember to take their medication every day. And they've appreciated all that. And it definitely has brought in more trust to patients, the way they see their dentist and the way it would be, because they do appreciate what we're doing. And it, as I said, it's connected medicine to dentistry more than when we didn't do this process.
Thank you, Dr. Nazarin. We're going to move on to Dr. Afshari real quick to get Levin to do his site overview, and then we'll move into the Q&A panel as well, where we can get a little bit more granular on some of the different things that you do at each of your sites. So, Dr. Afshari, you have the floor, sir.
Good morning, everybody. I hope everybody has a great day up to now, and the rest of the day is enjoyable for everybody too. I have different color scrubs too, but I just wanted to be make sure this is what I have to wear at work, so that's why my pictures, everything's the same. But I have other clothes, so just want to make it clear. Anyway, my name is Hamid Afshari. I'm the Chief of Dental Department at Saba Hicks. We are here in Tucson, Arizona. We're located in southern Arizona. Next slide, please. We basically have about 60,000 active patients in our hospital. About 11,000 of these patients are dental patients, and we serve the whole entire southern Arizona, part of New Mexico, all the way down to the California border and Mexico. We believe it or not, we have a lot of veterans who are in Mexico, and we do see them here. Next slide, please. This is a care pathway, actually, the simple way to describe our pathway. It's basically this integration of the oral systemic health and oral and systemic health. It's a collaboration between the dental service, medical services such as emergency room, cardiology, primary care, and each step is by resources such as patient education, clinical guidelines, and follow-up materials. And so instead of feeling like a separate system, we operate as a connected network, and that's what it makes it a very effective pathway. Next slide, please. So I put this in. Reason for it is we basically change the patient's vitals, and we also evaluate the patients. We look at the red flags. These are the red flags: chest discomfort, shortness of breath, altered mental status, arrhythmias, sepsis indicators. And those are the red flags we look at before we basically make a decision to send the patient to ED or call our rapid response team in our hospital. Next slide, please. These are some of the common reasons we send our patients, refer them to ED: syncope, abnormal vitals, fever, infections, persistent hyperglycemia. Next slide, please. And the way we do our referrals, communications through the hospital is through the progress notes. We have encrypted emails, and we also have the Teams messaging that we use. We also have referral forms for emergency room, which I didn't put a copy here, but basically when we refer a patient, before we send the patient to ED, we fill it out. It's like 4 slots, we fill it in, we put the patient's symptoms, the reason patient is going. And if we decide to order any labs or any radiological studies, we put it in, and that's going to help the triage nurse to make a decision, or actually also the triage physician, what to do and which route to take. Next slide, please. This is actually more complicated, but this is how we basically do our care pathway. Is if the patient is unstable, we usually directly send them to emergency room or call the rapid response, which do the same thing: come in, stabilize the patient, and refer the patient. We take the patient to emergency room. From there, patients get evaluated and sent for consultations to endocrinology, cardiology, or get other medical specialty, and become stabilized, go to primary care, and the primary care, they get a clearance, and then they close the loop and send them back to us when they're stable. If the patient is stable and we assess the patient here in our clinic and patient is stable, they just need to have primary care evaluation. We just send them directly to primary care. We either send the notes to primary care and follow it up by encrypted email, or as I said, by the Teams messaging, and communicate with the primary care and let them know what's going on. And through that, we close the loop, and we basically make sure patient gets a follow-up and we get all the results, and patient gets taken care of. So this is basic, very basic way of how we do our care here at Sabo Hicks. Any questions? Thank you.
Thank you, Dr. Afshari. Appreciate that. Thank you for everyone for your overview of your site. And I think the next step we'll do is we're going to transition to our panel Q&A. So Brooke, if we go to the next slide, please. Thank you. I'm going to rotate through each of the speakers and have you each have a chance to kind of address the questions, some of the questions that we've got. So Dr. Allen, let's start with you, sir. How can a standardized, excuse me, I'm going to get my correct questions. Well, let's talk with this one. How can a standardized BP screening align with the evolving concept of dentistry as part of integrated care? What are your thoughts on that?
What it does, it removes, it creates continuity. We have that standardized blood pressure, protocol. It's followed by the American Heart Association. We're constantly, through our learning collaborative and writing group, updating any, new recommendations or guidelines that they put forth for us. And so then that streamlines your referral to to your cardiology or primary care so that they know they're doing the same thing that we're doing so that they can expect an accuracy in that. And overall, it's just giving a sense of quality of care to treating the whole patient. We're all on the same page by following these standardized procedures.
Dr. Nazarian, same question. How does BP screening align with the evolving concept of dentistry as part of integrated care? You may still be on mute. Maybe having some technical difficulties. Same question to you, Dr. Afshari. What are your thoughts?
Well, I believe that blood pressure, measuring the blood pressure and screening blood pressure in a dental setting is a key component in integrating the oral health and systemic health, and as a basically say whole health when we're looking at it. We can use basically a good use of a dental visit for early detection. We can basically use it as a preventive measure for health problems. It's a very simple way, just by measuring vital signs. We can bring to the attention of the patient that they have some issues and they need to basically follow up with their cardiologist or with the primary care about their systemic health. It improves the patient safety basically. So it basically, to me, it plays a major role in overall patient's health care, and it's something it needs to be done as a healthcare professional. Not only dental, I believe it has to be done in every setting. If you're gonna do any type of procedure on a patient, if you're going to do any type of interventional procedures, if you're going to administer any medications to patients, you really want to know what the baselines are. So it is pivotal. And I believe it really is necessary for dental providers to do that.
Good.
You, Dr. Afshari and Dr. Allen. And a follow-up question that we're seeing in our chat. We understand some of the important aspects of that standardized blood pressure screening and refer process, but can you talk about some of the challenges that you experienced during implementing that process in your clinical settings?
You want to go, Dr. Allen, or
Go ahead.
Well, the challenges I had, basically, I come from an academic background. I'm a specialist, and I used to train residents at different institutions, Johns Hopkins and University of North Carolina, and basically we are going to start a residency program here. So it was something I had faced before, but it didn't scare me. And believe it or not, when I came in here, the first thing I did, I studied, what people were doing. I have about 13 dentists under me, and it's a big clinic. I have 39 people working here, and they're providing treatment on patients, medically compromised patients. And what I was looking at was First of all, to see if what they're doing is safe, the safety of the patient. I looked at what they're administering to these patients, how much epinephrine they're administering. What are they doing with the patient's medical history? Are they like following up at the labs? Are they really like looking at the labs? Are they looking at the patient's vital signs? So those were the first thing for the first couple months I was looking at. And what I realized was there were some issues. So the best thing is, we use honey to catch flies, but that's how I do it. So very likely, I told them, I educated them. I have lots of lectures, and the first thing I did was given lectures about the use of epinephrine, how much epinephrine we should give to cardiac patients, to patients with hypertension, what's the max we can give. I give lectures about hypertension, diabetes, cardiac patients. I started educating these people, and that was the first step I did, because first I thought it was like a lot of stress. They were stressed. They were like they were uncomfortable. When I talked to them, the knowledge base was not there, and they were kind of inexperienced, I would say. But the solution was just a training, and by training them, by giving them lectures, by giving them refreshers. Every year I do that. I do give them lectures, refreshers, and we have like some reinforced competencies, and they're good now. I mean, it's so good. I mean, my hygienists come in, knock on my door, Ed up. I have this patient with this blood pressure. Do you think I should give epinephrine, or how much epinephrine should I do? We do calculations, or we basically talk about it, decide what we're going to do. Are we going to treat the patient, or are we going to refer the patient to primary care? So it became really, really routine now. And I'm really proud of them. We have saved so many lives now. I have a log now. We have saved people who had MIs here in this clinic. We send them, they end up like, having right away, they took him to OR for bypass. We had patients who ended up, they had bradycardia here. We saved their lives. They just went, we took them from here. We diagnosed them with, bradycardia and unstable angina or other issues, arrhythmias. We take them to ED. Some of them end up, with pacemakers. It just happened for over past like 3-4 years I've been here, and I got great staff, and that was the challenge I was facing, inexperienced staff, and they were scared. But by just training them, by being there for them, and they are very competent, and it's just that was my challenge, I would say.
Can I say something about my challenges? Can you hear me?
Yes, go ahead,
Hello?
Dr. Nazarian. Yep.
Yes. So in my case, it was pretty simple in my case, because I'm in a private practice, and in our practice, we would have patients come in, and some would be very adamant about not wanting to have blood pressure taken in the dental office, because they would say that, I'm here for my teeth. I'm not here to get my blood pressure taken. And we would have, that was again, lack of information and lack of knowledge, which Dr. Afshari referred to. And then as we started speaking to them and explaining to them more, and they understood more, we sometimes had to say, maybe you can read about this more, and when you come back next time, we can take your blood pressure. We didn't push them too much to make sure that they're comfortable. And then the second time when they came in, we were able to take their blood pressure and proceed and make them understand that this is part of dentistry, is part of their overall health. It's not just separated. The head doesn't go separate. So they and we also said, we're not diagnosing your anything here. We're screening, and we need to screen for our procedures. We need to screen as well. And so they started understanding it for those that weren't completely on board with us at the time.
Your thoughts, Dr. Allen?
Yeah, I would, being in the private practice mode there, I agree with Dr. Nazarian. Yeah, it's my biggest problem in the beginning was staff training. I'm getting that done, getting them comfortable, because you're doing it's a shift in what you've done forever, really. Even though we've taken blood pressures, we didn't really expand on it, on like, here you are. Yeah, and if it was too high, right, we would say, no, we can't treat you today. But taking it the next step further and getting them to own the problem and do something about it, that made staff a little uncomfortable right at first. The training with them getting onto the standardized taking of the blood pressure, that took a little time, but we got there. But the main thing in the questions that the staff was asked right off the bat, like Dr. Nazarian said, like, why are you doing this? I don't want, don't bother me with this. It right at first it kind of takes them aback, but in the implementation guide of our what we created here with the Healthy Smiles, Healthy Hearts, is there scripts involved. We used those scripts that were created for the staff to use to talk to the patient. And at first you might read those scripts and go, okay, seems a little intense. It's not. It's very to the point, answers the question, calms the patient down, so that then moving forward with getting them to listen to you, uh, accept their problem as legitimate and need something done, it was really helpful. But I got that same pushback with just fix my teeth and forget about that. That's not your problem. It's like, and once you kind of like Dr. Nazarian does, you work with them a little bit, they end up thanking you. And there has been, like Dr. Afshari says, some significant life-saving results from what we've done. I've had a number of them in my practice also that later on I could share with y'all that just kind of amazing. You don't think about it until it happens, and then you go, wow, what we're doing makes a difference.
Fantastic. When you encounter the opportunity to refer a patient to their primary care physician, can you go in depth a little bit of are you using an EHR? How do you get that referral to that PCP? I know each of you is kind of a unique site. So, Dr. Afshari, we'll start again with you. Kind of address how you do that and get your patient to that primary care physician.
Basically, I may write a very detailed note. We record, we put every findings in the record. We chart all the blood pressures, all the vitals, and write a note about patient symptoms, everything, all the findings, we find. As I said, if the patient is stable, and we basically write in the chart that this note will be, that's how I put it, this note will be sent to Dr. So-and-so to review and manage a patient's blood pressure or diabetes or whatever. And I send it for cosign. And then I usually follow it up with an email or a message through the Microsoft. I got great colleagues here. They're they're very good, and they usually within a couple hours they will respond. We do that all the time. That's very routine for us.
So, are you using an EHR then, sir, to
Yes,
get that message over? And what EHR are you using?
It's called CPRS. That's unique to VA medical centers.
Very
yes.
interesting.
Yes.
Very good. Dr. Nazarian, how about you? How are you getting your patients referred to your PCPs? And are you using an EHR as well?
To start with, no, I'm not, and I'm not using any EHRs, but because it's a private practice and patients come in one at a time, we do have a very close relationship with our patients, and we as I said, because we can't, if they don't have a PCP, then they have to initiate the process of finding a PCP and through their insurance. And then once they do, we do definitely give them the little cards that have the measurements written on them for their blood pressure. And we follow up with them directly. We call them and we tell them, okay, did you go? And we email or text and or as I said, whatever they prefer, whatever way they communicate with us. And we do see a lot of patients once they get, like, we keep telling them, okay, this is serious. We need you to follow up. We have seen patients maybe after several trials to finally go find a PCP and go to have this checked out and not keep postponing it, because we do make a point that this is important and educate them and yeah, that's how we do it so far. It's been working, and I think as long as the patient has the willingness to follow up on their own health, and you give them some reason that this is important and explain to them, they do it. They're, nobody wants to be unhealthy and lose their lives. So yeah, we've been it's been pretty helpful that way.
And Dr. Allison, same question to you, sir.
Oh, yeah. So we do it's similar kind of a communication network. Once we do a referral, I don't use an electronic health record yet. I'm waiting for that with Epic to get a little more uh, user friendly, let's say, for the private practice, solo practitioner. Um, what we do is once we identify the need for a referral, we create, a report, based on what our screening findings are. And then what we do is based on because it's a kind of a diverse population, my practice is everything from those that do have adequate insurance coverage to those that have none. And we don't, so we have a network of clinics, low cost, low income, whatever kind of, clinics for the underserved kind of a thing that we have direct contact with them, that if the patient doesn't have someone and can't afford it, we have a direct contact with those clinics. And then with the patient's medical insurance, we verify, who it is that is their primary care or who's in their network if they don't have a primary care. But we do a direct contact with the primary care physician's office to set up appointments for the patient. If they're, while they're there with us, we will offer that to them. And then if the patient isn't there, or if we haven't had a successful contact, we keep contacting, and then we follow up with the patient. We keep them in the loop that this is what we've done. This is what you need to do. And then like Dr. Nazarian said, then we go back and say, did you go? Has this happened? So we keep this contact going by phone more than anything. We do have email follow-up and things like that, but we go for direct contact with someone in that office, that we have a point of contact so that we can ensure that they're going forward. And in some cases, it doesn't happen. They just say, I don't know another word to say than mind your own business kind of thing, which, okay, fine. But we've done the right thing. Just like taking the blood pressure to begin with is the right thing to do. And not just taking it, but doing something about it. I think that's kind of the core of the Healthy Smiles, Healthy Hearts program.
Right. And in that same vein, Dr. Ellen, how can those screening results be used to strengthen your patient trust and engagement in their overall health, not just their dental health?
Oh, it's amazing to see how it doesn't just stop with their blood pressure. Like Dr. Afshari says with the blood A1C, with their diabetes situation, overall health. It's amazing. It's like opens a door of, I haven't thought about this, or no wonder I feel like not good, all the time. And then they own that health situation and they start doing something about it. And you see them kind of pick their step up once you see them in the office, for follow-up care. You can see a change in attitude, a change in demeanor to where it's like, wow, this makes a difference. And they thank you for it. It's not just it's a practice builder. I mean, I don't I'm going to say it. It's a marketing practice builder because we'll have these patients they'll refer their friends and family. Oh, you're the guy that takes the blood pressure and got my friend, my family member help. So it's like they're listening. It's making a difference.
Same question to you, Dr. Afshari. Your thoughts on that?
Well, basically, it basically improved the clinical decision making for us, for my staff. And I could see it vividly, like how they are now that when they plan to administer medications, prescribe medications, they're paying more attention to the patient's medical history, vital signs, to see what prescribed, how much to administer, how much epinephrine to administer, or if they're doing invasive procedures, then they plan it much much more carefully. Also, as Dr. Allen and Dr. Nazarian mentioned, the patient's education, it's great. It basically, we are educating patients. And this has been very fruitful in a sense that patients are understanding now that, oral health is totally integrated with systemic health. We explain to them, in layman term, okay, your teeth, your mouth is attached to a head, and your head is your part of your body. So there is nothing, basically unfamiliar with your body and your mouth and your heart and anything. They're all interconnected. So when something goes wrong in your mouth, something else can go on your other part of your body. We talk about inflammation. So it's very interesting. We talk to them and we educate the patients, and they really appreciate that. They really understand, the amount of and they really appreciate you when you talk to them and you explain to them. They really understand it. For us, we don't need to have a market because our patients are there and we don't need to advertise. But for private practice, I think it's very good for docs who are in private practice and they need to rely on having referrals, and that's a great marketing has a great market value. They're going to a dentist or dental provider who really cares about their overall health. They're not, I mean, that's the type of dentist I want to go to. When I moved to Tucson, that's what I was trying to find. I want to go to somebody who I really can, trust, do a good work, who understand, what's going on with the whole, healthcare, for whole health, not just my teeth. So I totally agree with what Dr. Allen said.
Dr. Nazarian, how do you think screening results could be used to strengthen patient trust and engagement in their overall health? What are your thoughts on that?
Well, we definitely, as I said, it opens up the conversation between us and the patients. And because they ask, why are you taking my blood pressure? Like, let's say for a routine cleaning. And we explain to them, well, because your overall health is affected by your oral health. And when we do a cleaning and we see a lot of bleeding and inflammation, and at the same time we see high blood pressure, we can tell you how these two are connected and how it's important that you do something about it. even more so than a person who has a normal blood pressure. And if you do have a normal blood pressure and you have a lot of inflammation in your mouth, then we can tell you, okay, well, realize that you have a lot of inflammation in your mouth. This is going to go and affect your health, uh, uh, your heart health and your blood pressure. It's going to affect all that. And even though you have it normal now and you're young and everything looks good, this is asymptomatic and you will not know that it's happening. And one day you will have a high blood pressure, and now you have to take medication, you have to do things to lower it. And all this information makes them think twice and makes them realize, oh, okay, this is what they're, I mean, we're simple thing. We're talking about cleaning and, an appointment when they come in just for a regular cleaning, and all of a sudden it turns into a conversation between heart health and their oral health. And I think that's the beauty of it, that this um, screening brings about a lot of good things to our practice and also to our patients. And it's important to integrate blood pressure taking into our practices. In this day and age, we're not living in 17th century. We need to be very inform our patients and take initiative in making sure that they get the best care, but not just the care, but the information. It's not just we do the work and we send them home and we don't talk anymore. It's not that era where the dentist just sat down and did the drilling or cleaning and then sent the patient home and okay, rescheduled for the next 3 months or 6 months. So that's a difference. I think we have to change with the times. And yeah.
Absolutely. So, Dr. Nazarian, where in what spaces do the screenings occur in your office? We've got some really good questions from the Q&A. And then speaking of that, the supplies needed for the screenings, where are they kept? Like your BP cuff and such.
We have a counter that we put it on. It's not a big, huge machine. It's what AHA has, you can go through the list of recommendations that AHA has and order one of those that suits your office. And then also the space. I don't have a huge office. It's like I have 3 operatories, and there are small operatories, and they sit on it on my chair, and they put their arm on the counter, and we do the measurements before they sit in the dental chair. So those are small accommodations that you can make. It's nothing. We don't have a separate room for that. It just works. You
Sure.
can make it work.
And Dr. Afshari, how about you as well, sir?
We actually have the blood pressure monitors in every operatories, and these are provided to us by the biomed in the hospital. So it's available in our clinic. We have 20 operatories, so each operatory has their own blood pressure monitor. We have 180 in the clinic. We have basically all the emergency supplies needed, crash cart, everything, defibrillator. So that's our setup here.
Dr. Allen?
Yeah, we have a monitor in each operatory, and we sit the patient before the dental chair. We have them sit in just a chair we have in the operatory. off to the side to take their pressure, kind of the standardized procedure. And one thing we do is we keep batteries in each operatory to make sure, and they're changed on a regular basis. Even I think we could do it monthly is our schedule here, because that's one of the things you got to be calibrated. You got to be sure these machines are ready to go with each patient. And so, yeah, each operatory we have it available.
Very good. So if you encounter a patient that has elevated blood pressure, how do you reinforce the importance of postponing treatment for that patient? How do you address that with the patient successfully, or sometimes maybe unsuccessfully? Dr. Allen, we'll go back to you again.
Okay, first of all, when we do take the blood pressure, there's an algorithm that Healthy Smiles, Healthy Hearts we developed that we follow to the T. You follow the algorithm, it tells you what to do, what to say, what to recommend. So there's no gray area with this. It's very to the point. Usually, and of course, the higher the blood pressure, the scripts that are involved in that algorithm are very impactful, let's say, to get the patient's attention. And we as practitioners just need to, you need to drive the point home. And, just this is a have to. You got to do this now. This is a now thing. And if it's an initial visit, it can be overwhelming. And sometimes that patient, if it's an immediate referral, I haven't had a whole lot of those, like an immediate emergency department referral. I hate to say it, but it's like a 50-50, kind of thing. And we'll call ahead and make sure they showed. 50 show, 50 don't. That's just something, you can't do anything. Go ahead. Oh,
Yeah, no, I think there was just some background noise there. Anything else following up there on Dr. Allen?
Just that it's if you follow that algorithm, it takes you from the simplest, let's go ahead with treatment, to like calling an ambulance, a 911 call. There's nothing, you don't have to panic. You're not, by implementing this program, you're not getting in over your head if you follow the guidelines that we've put forth.
Very good. Your thoughts, Dr. Afshari?
Well, that's something, I usually used to tell the residents too, that don't panic and don't make the patient panic. Use simple words, layman terms. You don't need to become really technical with the patient. They don't understand it. Just use simple words, be calm, let the patient know, very quick explanation, why we cannot see you, a reassurance that they're going to be okay. It's nothing to worry about. It's blood pressure. We have to get this under control. And we're going to make the referral, and he's or she's going to be okay. That reassurance probably helps a lot. And we tell the patient the reason, and in a very layman term, we're going to give you medication that may raise your blood pressure and cause complications. We're trying to prevent that, from happening. So before you get sick, we want to make sure you're okay. We try to send you to emergency room, or we recommend you to see your primary care. Again, in my slides, I was trying to fit it within 5 minutes, to go over it fast, but we do assess the patient. And if there are red flags, if the patient seems unstable, we call the rapid response, or we send them to emergency room. Emergency room for us is like next door to us, which is very convenient, and we send them there. But if they are, if I was in private practice, I would probably, if they're unstable, I would call 911. I wouldn't let patient go home drive. But again, I wouldn't panic, make any panic or any, and use just very calm voice, let the patient know what's going on, and just reassuring the patient they're going to be okay, and let them know what the issue is. Very, very calmly.
Very good. And Dr. Nazarian, your thoughts on that as well?
Well, we usually see our patients and prepare them before the major procedures. In other words, if we're going to see them for like for example, gum surgery, which I do have a periodontist who comes to my office to do some surgeries, and we definitely check beforehand when they come in for their regular cleaning before the big day. And if they have a history of high blood pressure, we make sure that we prepare for that, make sure that we talk to the PCP and that it's all under control before we see the patient um, for the surgery. However, if on the day of they have high blood pressure, then we do dismiss them. And we've had occasions when we've done that, and just make sure that we contact the primary care provider and let them know that this is, the even though we thought that the blood pressure was under control, that this is what's happened right before the surgery, and we follow up with the patient and make sure that everything is controlled before we proceed. But we haven't had issues with our protocol.
Good. Well, we're coming up to our last question, and then I'm going to give you each about 30 seconds to provide one tip that you would give to dental sites that are exploring the opportunity to participate in this initiative and how they could start tomorrow. So let's swing right back to you, Dr. Nazarian. What is one tip that you think you would give to those that are exploring this opportunity to participate?
I think they shouldn't waste time. They should right away start the initiative. It can't do any harm to their practice. It's only gonna improve their practice, and you can just, simply train your employees in a meeting or two, and then just get them started. Make sure they have some information about how to answer questions, and if they get caught up in something that they can't handle, to call you over, and you can handle it and take care of it and explain to the patient and move forward. And in no time, this will become part of routine, just like X-rays are part of our routine.
Very good. Dr. Afshari.
Well, I agree with Dr. Nazarian. Start right away, and I would say start today, or at least, if not today, tomorrow. Get the blood pressure. It's our duty to basically practice safe, and it is something we have to do. Checking the vitals, as I said, it's pivotal factor in dentistry, and we are providing the treatment. We are performing procedures. Dentistry is a procedure-driven specialty, and we are dealing with pharmaceutical administrative pharmaceutical prescribing, medication. So there is a lot of stuff involved. It's not only about drilling and filling. We are doing more than that. It's something we really need to educate our staff, educate ourselves, and educate our patients. Again, the American Heart Association came with great guidelines. These are guidelines. As I used to tell people, we don't go, we use the guidelines to practice. Dentistry and medicine are practicing. They're not like chemistry or cooking. There is no recipe. You practice. It's your experience, your judgment, and you use the guidelines, and that's your clinical judgment, how you basically bring it, and you basically in the field of dentistry of medicine, and to help the patient. So use these guidelines, save patients, headaches, and be safe for the patient, and basically provide safe care to these individuals.
Very good, sir. Very good. And final word, Dr. Allen.
Yes, I would say start right away. bottom line, it's the right thing to do for your patients, and you're gonna save lives. You might not think you will, or it's like, oh, you're screening. Remember that always. You're not diagnosing, you're not treating, you're screening. Always remember that. And it's something you should do right away. It's the right thing to do. You are going to save lives. You're going to make a difference. And implementing this program, the American Heart Association with the Healthy Smiles, Healthy Hearts program, download the implementation guide. All your questions will be answered. There'll be a step-by-step recipe procedure to follow. Any problem you might encounter along the way, whether it's with training, patients, whatever, it's answered in there. It's an exhaustive text as to how you can implement this program, and just do it, make a difference.
Very good. Well, thank you all for being on today's webinar, especially to our esteemed panelists. This webinar is part of the AHA Healthy Smiles, Healthy Hearts initiative. Again, we want to thank you, our audience, for your participation in today's event. After today's webinar, you'll receive a follow-up email, the survey on the presentation, and we would appreciate your completion of the survey and your feedback. In that email, you will also receive a link to review a recording of today's presentation. On behalf of the American Heart Association, thank you for joining us and have a great day. This concludes today's presentation.
Thank you.
Thank you.
Thank you all.
Have a great day.
Bye-bye.
Thank you.